Happy Nurses Week to all the nurses and future nurses listening. To celebrate, I'm having a 20% off sale on Study Sesh. This is my private podcast that features over 140 episodes to help you study on the go. Formats include pod quizzes, power hour deep dives, drills, and case studies. If you're tired of sitting at your desk or staring at a screen, but still want to review for nursing school, it's time to check out Study Sesh. Go to straightanursingstudent.com and click on Courses in that top menu bar. That's straightanursingstudent.com and click on Courses in the menu bar. See you there. Well, hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and beyond at the bedside. I'm so happy you are here with me today. We are diving into a maternal newborn topic. So I haven't done one of those in a while, so I'm just really jazzed that you're here and really jazzed to bring this topic to you. Before we do that, though, let's take a quick minute for our listener shout out. And this one goes out to someone who goes by the name Runner Girl, who says this: I found this podcast at the end of nursing school, but love using it to help me study for NCLEX. Nurse Mo has great mnemonics. They stick in my head whether I'm listening to the podcast, on a run, a bike ride, or commuting to work. Thank you, Nurse Mo. Well, I just want to say thank you right back to you for taking the time to share how you're using the podcast to help you study for NCLEX. I want to wish you all the very best on that exam and in your career as a nurse. So today's topic is molar pregnancy. And I have to say, I've been practicing saying hydatidiform over and over again. So let's cross our fingers that I continue to be able to say it. So a molar pregnancy, which also goes by the name of hydatidiform mole, is a gestational trophoblastic disease. So in this episode, we'll talk about the difference between the two types of molar pregnancy. We're going to look at who's most at risk for molar pregnancy, the complications that can occur, and then we'll get into the latte method, looking at signs and symptoms, assessments, tests, treatments, and education. So as I mentioned, this is a gestational trophoblastic disease, and trophoblasts are those first cells to develop once an egg is fertilized, and they supply the embryo with nutrients and eventually become part of the placenta. In a healthy pregnancy, this process is very well controlled by the body. But in GTD, or gestational trophoblastic disease, the body's regulatory systems are not working properly, and this leads to the proliferation of abnormal tissue that resembles these clusters of grapes. The molar growth must be removed because it has the potential to develop into a choriocarcinoma, which is a rapidly metastasizing malignancy. So, hydatidiform moles can vary in their composition. So, there's complete and there's partial. So, complete molar pregnancy and partial molar pregnancy. In a normal pregnancy, the embryo gets one set of chromosomes from each parent for a total of 46 chromosomes. And like I said, these hydatidiform moles can be complete or partial, and each type has chromosomal abnormalities. So let's dive into what that means. Let's first look at a complete mole. So the complete hydatidiform mole has no chromosomes from the egg. So the egg has no nucleus. It doesn't have any maternal DNA. It has no genetic information in it. It's abnormal, right? So we have an egg with nothing in it, essentially. And then we get 23 chromosomes from the sperm that fertilizes that egg. This occurs, again, when an egg has no nucleus and it is fertilized by either a single sperm or It can be by two sperm, but that's not nearly as common. In a complete hydatidiform mole, the egg is empty, again, and no fetus develops, not at all. So looking at chromosomes, 23 from one sperm, which is most common, or again, two sperm could happen, not as common though. The HCG level with a complete molar pregnancy is going to be very high. We're talking over 100,000 milli-international units per milliliter. That's very, very high. As for a fetus, none is present. No fetal parts are present. And then the placenta can be present, but it's pretty abnormal. We'll talk about that more later on. And then the DNA component, only paternal DNA is expressed. That's all that's present in this tissue. So that's that complete molar pregnancy or that complete hydatidiform mole. Then there is the partial hydatidiform mole. And this occurs when an egg that does have maternal DNA is fertilized by two sperm. In this case, there's an excess of genetic material. Many partial moles are misdiagnosed as spontaneous abortions or miscarriages and are only discovered after the tissue is examined. So, looking at those same characteristics here for a partial mole, looking at the chromosomes, we have 23 from the egg and then 46 from two sperm. So, 23 chromosomes from each sperm. That's going to add up to way too many. HCG levels may be normal in a partial mole or maybe a bit lower than normal. The fetus may be present, fetal parts may be present. The placenta is present, but it is also abnormal. And then as far as DNA goes, maternal and paternal DNA is in this tissue. So now that you have a brief understanding of the differences between a complete and partial molar pregnancy, you might be wondering, who's at risk for this? So individuals at higher risk are those with a previous molar pregnancy, adolescent pregnancy, and then advanced maternal age. I saw over age 35. I also saw over age 40. Individuals who smoke, individuals with previous infertility issues or spontaneous abortions or miscarriages, and interestingly, a diet deficient in vitamin A or beta carotene. And then there are some complications of molar pregnancy to know about. And one of the key complications of molar pregnancy is the progression to gestational trophoblastic neoplasia, or GTN. And this includes choriocarcinoma, epithelioid trophoblastic tumor, and invasive mole. And these are malignancies that metastasize and may be fatal if not treated. The main treatment for malignancies of this type is chemotherapy, but some individuals may also require a hysterectomy. They may require radiation or a combination of therapies. Note that gestational trophoblastic disease, or GTD, can occur in cases of multiple gestation, where there's a normal fetus and then the other is a complete or partial mole. This definitely requires very, very careful prenatal management in order to have a live birth of that viable fetus. Other complications include infection that can progress to sepsis and even shock. Preeclampsia is another one. Hyperemesis, leading to dehydration, leading to malnourishment. Severe bleeding can occur. Thyroid storm can occur, and we'll talk a little bit more about how hyperthyroidism is a possible side effect or possible consequence of a molar pregnancy, and it occurs in about 7 to 10% of cases. And then pulmonary edema would be another complication. Not very common, but it can occur. Now that we've got the background information out of the way, let's dive into the nursing implications, the nursing care of these patients. And to do that, we'll use the straight A nursing latte method. So the first letter is an L, and that stands for look. How does the patient look? Basically, what are their signs and symptoms? So, the common signs and symptoms of molar pregnancy include vaginal bleeding that may appear kind of dark brownish or prune juice colored. It could also be bright red, but it may often be this dark brown or prune juice colored blood. The individual may pass tissue that resembles little clusters of grapes. The uterus will be larger than is expected for gestational age or, where they are in their pregnancy. And with that, the individual may have pelvic pressure or pain. The pain could also be from the presence of ovarian cysts, which can occur in a complete molar pregnancy, and that's simply because of the elevated HCG levels. And then hyperemesis gravidarum could also be present, most likely to be associated with the complete molar pregnancy again, and it's due to the really high levels of HCG. And then less common symptoms include hyperthyroidism. I mentioned that thyroid storm would be a serious complication, and that can occur in individuals with hyperthyroidism. And the reason for that is that HCG, which is really elevated in a complete molar pregnancy, is believed to stimulate the thyroid to produce more thyroid hormone. And another not as common but definitely possible symptom is early onset preeclampsia. And that would be preeclampsia occurring before about 20 weeks. So, again, common signs and symptoms: vaginal bleeding, might be kind of prune colored, passage of clusters of tissue, little grape clusters of tissue, enlarged uterus, pelvic pain, pelvic pressure, vomiting, and then a little less common hyperthyroidism and early onset preeclampsia. The next letter in the latte method is the letter A, and that stands for assess. So, how do we assess this patient? What are we going to be doing? So, we can measure fundal height. It's going to be larger than expected for how far along we believe this individual to be. We'll monitor eyes and O's. If they're vomiting a lot, we're worried about dehydration. Let's keep track of eyes and O's. We'll also, of course, monitor for signs of bleeding. And we'll assess the patient for signs of hyperthyroidism. Even though it's not super common, it can still happen, and you definitely want to recognize it if it is occurring. And this would include things like tachycardia, tremors, anxiety, increased appetite, sweating, irritability, things like that. And we'll also monitor blood pressure because they could have that early onset preeclampsia. Now, before we dive into the next letter in the latte method, which is a T, let's take a quick minute, have a little break, and then when we come back, we'll dive into the tests. Warmer, sunnier days are calling, and the last thing I want to be doing is cooking and meal prep. That's why I love Factor's no prep, no mess meals. Plus, their delicious meals are helping me meet my wellness goals for the summer, thanks to their calorie smart options. But I also love the keto and protein plus options too. Factor's fresh, never frozen meals are dietitian approved and ready to eat in just 2 minutes. So no matter how busy you are, you'll always have time to enjoy nutritious and great tasting meals. So make today the day you kickstart a new, healthy summer routine. With 35 different meals and more than 60 add-ons to choose from each week, you'll always have new flavors to explore. Plus, with Factor, you keep kitchen time to a minimum. Factor meals are ready in 2 minutes. No shopping, no prepping, no cooking, and no cleaning up. This means more time lounging by the pool. Head to factormeals.com/nursemo50 and use code nursemo50 to get 50% off your first box plus 20% off your next month. That's code nursemo50 at factormeals.com/nursemo50 to get 50% off your first box plus 20% off your next month while your subscription is active. So that next letter in the latte method is a T, and that stands for tests. So what tests would be utilized for patients with suspected or confirmed molar pregnancy? And the key one is going to be HCG level. This is a blood test that looks at the levels of HCG. And when we have a complete molar pregnancy, again, that level is going to be very high, exceeding 100,000. And then in that partial molar pregnancy, it could be normal or it could be a little bit lower than expected. So let's say we have an abnormal HCG level, then the physician may do a transvaginal ultrasound. This is again utilized when a molar pregnancy is suspected, though it's important to know that it could be inconclusive and misdiagnose the molar pregnancy as an incomplete abortion. So let's talk a little bit about some of the characteristics that might be seen on a transvaginal ultrasound with a complete mole versus a partial mole. So with that complete molar pregnancy, there's no embryo, no fetus, no amniotic fluid, and the placenta is going to be markedly abnormal with enlarged cystic spaces. You may hear this called a Swiss cheese appearance to the placenta. And then presence of ovarian cysts due to elevated HCG levels. And then with a partial mole, that transvaginal ultrasound would show a fetus or fetal parts. There is amniotic fluid, but it's likely to be low. There is again that Swiss cheese appearance to the placenta, so it's definitely abnormal, and an enlarged gestational sac. The key things to know here are complete mole, no fetus, partial mole, there's a fetus. A CT scan or a PET scan may be utilized once we have a confirmed diagnosis to further evaluate and stage the GTD, gestational trophoblastic disease. And then additional blood tests may be conducted depending on the individual's clinical presentation and what they need. This could be a CBC. Maybe we suspect anemia. Maybe we suspect infection, a renal panel. We could look at urine protein if we're suspecting preeclampsia or the patient has preeclampsia. We might look at liver enzymes and we might look at thyroid function. And then another test is simply the uterine evacuation. That's kind of considered a diagnostic and therapeutic treatment. Once the uterus is evacuated, confirmation of molar pregnancy is possible with examination of that abnormal tissue. And then after uterine evacuation or a D&C, HCG levels are continually monitored on a regular basis until they return to baseline or normal. And if the HCG level does not normalize in that post-operative period, this is suggestive for gestational trophoblastic neoplasia, and the patient may need chemotherapy. Now let's move on to the next letter in the latte method, which is another T, and that's for treatments. So the main treatment for molar pregnancy is evacuation of the uterine contents. This can be done as an outpatient procedure. It may be done in the OR under anesthesia. And basically, the procedure involves dilation of the cervix, suction aspiration, and sharp curettage to ensure that we have all the tissue out of there. We don't want to leave anything behind. A hysterectomy may be beneficial or indicated in some patients, such as those over the age of 40, or for an individual who does not wish to have additional pregnancies. One key benefit of hysterectomy is it reduces the risk of GTN, or that cancer risk. Of course, treatments will be utilized based on individual complications as well, such as preeclampsia, bleeding, or hyperthyroidism. And then the final letter in our latte method is an E, and that stands for education. How are we going to educate the patient about this condition? So one of the key things that the patient should know is that since they are now at higher risk for molar pregnancy in the future, remember, that was a risk factor, they should know what signs and symptoms to watch for and to see their physician when they suspect they are pregnant. Teach the patient the importance of those follow-up HCG measurements and that they are necessary to evaluate if the molar pregnancy has progressed to a GTN, which would require additional treatment, likely chemotherapy. Ensure the patient understands to use a reliable method of birth control while undergoing these serial HCG tests, because if they get pregnant, that's going to make their HCG go up, and then we wouldn't know if it went up because they were pregnant or if it went up because they actually had a malignancy. You also want to teach the patient after a D&C or that uterine evacuation that light bleeding is expected. And if they notice some heavy bleeding, that would be abnormal and they should notify their physician. You want to also teach the patient to avoid using tampons or engaging in intimate activity until healing from the D&C is complete. And teach the patient to notify their physician if they experience fever, persistent or increasing pain, or foul smelling discharge. These would all be signs of infection. Let's do a little bit of pod quizzing to make sure that you understand this concept. Pod quizzing is when I ask you a question, give you time to think about the answer. If you're feeling sassy, you can say the answer out loud, and then I will say the answer. So basically, it's like doing flashcards, but with your ears. And if you like doing this style of review, then you have to check out Study Sesh. It's an entire podcast full of episodes that are essentially pod quizzes covering a wide range of topics, including maternal newborn. So, you ready to get pod quizzing? Let's go. Which type of molar pregnancy has no chromosomes from the maternal side? That is that complete molar pregnancy. Which type of molar pregnancy has the very high HCG level? That was also complete molar pregnancy. And then what complications can that high HCG level cause? I mentioned 3 when I was talking through this concept. So one of those was the vomiting or hyperemesis. Another was hyperthyroidism. And then the other was the development of ovarian cysts. Excellent. What type of molar pregnancy may have a fetus and amniotic fluid? That would be a partial molar pregnancy. If the individual is passing tissue, what does it resemble? That was clusters of grapes. Excellent. And then what if bleeding is present? What would the most common characteristics of the bleeding be? That bleeding may often appear dark or prune juice colored. Though with active hemorrhage, it's going to be bright red. That would be a very serious sign. What's going on with the uterus in molar pregnancy? Is it larger than normal, smaller than normal, normal size? Yeah, it's going to be larger than expected. Absolutely. Very, very good. What blood test is the individual going to have done repeatedly after they have the complete or partial mole removed? They're going to have HCG levels serially monitored. And why is that? What are we looking for? Very good. We're looking to see if the HCG levels normalize, because if they don't, or if they go up, this could be a sign that we're looking at gestational trophoblastic neoplasia, which is a malignancy that absolutely must be treated. And then, last question, can you name 3 of the risk factors for a molar pregnancy? Okay, good job. Hopefully you got 3, but some risk factors are previous molar pregnancy, being very young or older, so adolescent pregnancy or over the age of 40 or so, smoking, previous infertility issues or miscarriages, and a diet deficient in vitamin A. Very, very good. Congratulations. You've now reviewed molar pregnancy. You're ready for your exam. And again, if you like the pod quiz at the end, imagine having thousands of those questions coming at you in your ears, all categorized in different categories covering maternal newborn, pediatrics, med surg, mental health, fundamentals, then you definitely want to check out Study Sesh. You can go to straightanursingstudent.com and click on courses in the top menu bar. It'll take you to a page with everything that I offer. Super easy to find. And of course, you can always reach out to me if you have any questions. So I really hope to see you back here next week. And if you're following or subscribed to the show, then it will magically show up for you on Thursday. See you then. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.